Hello, I'm Vicki Gabbro, and I've been asked by the team at Fraser Health to talk to you about joint replacement surgery, how to prepare for it, what to expect, and how to get back in good shape as soon as possible following your surgery. This video was created by doctors and other healthcare staff to answer any questions you might have, because I'll bet you have quite a few. So to fully explain what it's like to have either knee or hip replacement surgery, this video has been divided into 3 parts. Part 1 is about preparing for surgery, and a healthy lifestyle will be emphasized here for now and for your future. Part 2 walks you through the hospital setting, and Part 3 addresses what to do after your procedure to get you back on your feet. You can watch all 3 chapters by letting this DVD just play on its own, or you can go forward and backward to the section of your choice. Together, these 3 chapters should give you a complete picture of what this procedure will be like, so you can be more confident and informed going in. Now, I haven't had joint replacement surgery yet, but I certainly know a lot of people who have, and I have a general idea of what happens. But before we continue, it might be useful to give you a basic overview of this operation, and I might learn a few things too.
Joint replacement surgery is needed because of severe joint disease, usually due to osteoarthritis, inflammatory arthritis, or avascular necrosis. These conditions cause the joint cartilage to wear away and the bone beneath to become damaged, leaving your joint painful, stiff, and deformed. There are a number of variations of procedures and materials used in joint replacements. Your surgeon will select an option based on your age, bone health, and general health, but the basics are as follows. Hip replacement. The hip joint is composed of the top of the thigh bone or femur, which forms a ball, the hip socket or acetabulum of the pelvis, and the muscles and ligaments that hold it in place. The procedure begins with your anesthesiologist giving you an anesthetic. Then the surgeon makes an incision. The surgeon moves or cuts the muscles and ligaments to expose the joint. Then the joint is separated, and the ball portion of the joint is removed and replaced with an artificial ball with a stem. This component is placed into the thigh bone or femur. The surgeon then removes any damaged cartilage from the surface of the hip socket and fits a new socket in place. The new hip is held in place either by cement or by having the bone grow into the new joint. To finish, the surgeon reattaches the muscles and closes the cut. Knee replacement. The knee joint is composed of the end of the thigh bone or femur, the top of the shin bone or tibia, the kneecap or patella, and the muscles and ligaments that hold them in place. The anesthesiologist gives an anesthetic. The surgeon makes an incision and then moves or cuts the muscles and separates the joint. The damaged bone and cartilage are cleared away from the end of the thigh bone or femur, and a new surface is applied. The end of the tibia or shin bone is cleared of old bone and cartilage and shaped for the new replacement component. In some cases, the back of the kneecap is cleared of damaged bone and a smooth plastic button-like surface applied. The surgeon puts the new knee components together. To finish, the surgeon reattaches the muscles and closes the cut.
Now that you know a little more about the procedure itself and what role the doctors will play, let's talk about your role in this process.
Part 1. Preparing for your surgery.
For a surgery like this, it's important to know that you're not just a patient. You're an active team member in this event, and that means there are actions you can and you should take before your surgery to benefit your recovery and help you in the long term. Preparing for your surgery is like getting ready for a marathon. In both cases, you're training your whole body for a major physical event, so you need to get ready, mentally and physically. And just like a marathon, you'll have skilled, supportive coaches by your side to help you along. So what do your coaches advise you to do before your operation? Well, here are a few tips.
Getting your body in shape.
Research proves that getting in the best possible shape before surgery accelerates your recovery and helps you avoid problems. So much of what we talk about here is important not just for now, but for your future health as well. As for how to do that, here are some suggestions.
Exercise. Though this may be difficult, building strength prior to surgery helps relieve joint pain, improve your mood, make you sleep better, and return you to health faster. Consult with a family doctor or a physiotherapist before beginning any exercise program. But try swimming, walking, or joining a special fitness program for people with joint or health problems. And work to strengthen your upper body. You'll be relying on your arm muscles to help you move around after your operation.
If you are currently in too much pain to exercise, please play the pain management chapter on this DVD for more information.
Eat well. Focus on eating healthy foods to give your body the right amount of vitamins, minerals, and nutrients to promote healing and fight infection. Try eating lots of fruits and vegetables, whole grains, legumes, fish, and red meat or dark meat chicken for iron, which strengthens your blood. And manage your weight. Now, most patients have a few months to prepare for surgery like this. Try using that time to return your body to its ideal weight. Consult with your family doctor or dietitian about creating a weight loss plan just for you. Or you could join a well-known program in your community to help lose any extra weight.
Rapid weight loss 4 weeks before surgery is not advised. Acceptable weight loss is about 1 pound per week.
Pain management.
Pain. It's probably the single biggest thing patients want to discuss with their doctors before an operation. And right now you're probably all too familiar with pain, maybe some stiffness or aches in your joints and muscles. That is why you're getting this surgery after all. But it may help to hear that pain can be controlled, and there are steps you can take before and after your surgery to increase your level of comfort. And a more detailed discussion on pain management can be found on the special features section of this DVD. For now, though, here are a few recommendations.
Before surgery, there are many ways to manage your pain. These may include non-medicinal methods such as exercise, ice packs, or rehab therapy. You will also likely require medications like Tylenol, anti-inflammatory drugs, or stronger medications called opioids. These may be used alone or in combination, and you may be required to take a dose regularly through the day. Following your surgery, your pain will probably be strongest during the first few weeks and will gradually decline over the weeks and months of your recovery. To manage your pain, you will be depending on stronger medications called opioids, such as hydromorphone, oxycodone, or morphine. Medications such as Tylenol and anti-inflammatory drugs will also play an important role. Non-medicinal methods like rehab therapy and exercise may also be prescribed.
Safe and effective pain management requires a partnership between you and your physician. Do not miss regularly scheduled dosages of medication or make changes to your prescribed medication without involving your healthcare team. Following surgery, you may be asked to rate or describe your pain using a pain scale with faces or numbers. This helps your nurses and doctors understand how much pain you are having to provide the best treatment.
Possible complications.
I know no one likes to think about what might go wrong during or after a medical procedure, but I have two things to say on that front. The first is that the vast majority of these surgeries go off without any serious complications, and the second is that there are things that you can do now to make sure you are less likely to experience the following post-surgical complications.
Preventing blood clots.
Having surgery on your lower limbs and being inactive during your recovery raises your risk of developing harmful blood clots. Clots, also known as deep vein thrombosis or DVT, can travel through your system to your lungs, causing shortness of breath and chest pain.
To minimize your risk after surgery, get up and get moving. Move your legs frequently. While in bed, pump your ankles every hour to improve circulation. Squeeze your thigh muscles or buttocks, hold for 6 seconds, then release. Simple walking is really the best trick. Your surgeon may prescribe special stockings or leg sleeves to wear. You will likely be given blood-thinning medication to reduce your chances of harmful clotting. You will take this medication for 10 to 30 days after your operation. These medications may not be available at all pharmacies, and you may be required to pay for a portion of the cost. Your healthcare team will advise you how to arrange this.
Notify your doctor if you develop pain, warmth, and redness in your calf. Go to the nearest emergency room if you have chest pain or shortness of breath. In some cases, this medication may require giving yourself a small injection in your abdomen. Your nurse will teach you how to do this while you're in the hospital. Refer to the Giving Yourself an Injection section of this DVD for more instructions. Risk of harmful blood clots may persist for up to 3 months after surgery.
Preventing infection.
Contracting an infection before or after your surgery can cause serious damage to your new joint. It can also weaken your system and make your body less able to heal.
To limit your exposure to infections, avoid crowds and people with contagious illnesses 1 month before and 3 months after surgery. Report any suspected infections to your doctor. Stay well nourished, and following surgery, take at least 10 deep breaths frequently to clear your lungs. If you feel congested, cough every hour. After your surgery, if you have any scheduled medical or dental procedures, inform your healthcare providers that you have had a joint replacement. As a precaution, you may require a dose of antibiotics.
Quitting smoking is strongly advised. Smoking increases your risk of breathing problems and lung infections after surgery and may slow the healing of your incision.
Avoiding alcohol withdrawal.
People who drink a lot on a regular basis may be at risk for alcohol withdrawal. This is a serious and potentially life-threatening condition. It may also interfere with anesthetic drugs and pain medication.
Avoid withdrawal by cutting back to 1 standard drink per day, 1 month before your operation. 1 standard drink is 12 ounces of beer, 4 ounces of wine, or 1.5 ounces of hard alcohol.
Consult your physician for specific instruction.
Managing existing diseases.
Some medical conditions like heart or lung disease, Parkinson's, or diabetes can increase your risk of complications after surgery. It's so important that any medical condition is under control before you have your operation.
See your family doctor or medical specialist for a complete tune-up at least 6 weeks prior to surgery. You will also be contacted by the hospital to attend their pre-admission clinic prior to your surgery. Understanding post-surgery delirium.
Some people might feel foggy or confused after undergoing major surgery. In most cases, this condition goes away within days, but it can take up to a few months. So don't worry, doesn't mean you're losing your marbles. Many factors may cause this, such as pain, a different environment, or medication.
Let your medical team know if this has happened to you before. You can also minimize the risk of delirium by avoiding alcohol, eating a balanced diet, and coming into the hospital in good physical and mental shape. Preventing hip dislocations.
After surgery, there are certain movements you'll need to avoid because they put pressure on your healing muscles and could cause a dislocation.
These movements include bending forward or raising your knee, twisting, sitting on surfaces lower than your knee, crossing your legs, and rotating your legs. For knee replacements, squatting and kneeling place excess pressure on the knee joint and are not advised.
To further help with this, there are improvements you can make to your home to help you get around safely.
Setting up your home.
Now, a typical hospital stay is between 1 to 3 days, so most of your recovery time will be spent at home. And home is a far nicer place to recover, all things considered. You're surrounded by familiar things, you can eat your own food, you can sleep in your own bed, and you can avoid many infections that may exist only in hospitals. The comfort and safety of your home will be important factors in getting you back to peak health. Here are a few tips for getting it ready.
Make sure walking areas are free of clutter and loose carpets. Consider rearranging your space to make it easier to travel from room to room or between levels. For example, you could move your bed to the main level of your home. Make sure you have secure railings in your stairways. Have adequate lighting for nighttime safety and a walker or crutches to help with indoor movement. In the bedroom, make sure the top of your mattress is level with or above your knees. In the bathroom, install a raised toilet seat, safety frame, and grab bar on the wall. For safety around the tub or walk-in shower, a chair or bench along with a grab bar will provide the proper support. Installing a long-handled shower hose if using a tub may make bathing easier. In the kitchen, rearrange items you use regularly so they're more convenient to reach. A cart for transporting food and other items is often useful in the kitchen. Organizing equipment.
You will need to acquire certain medical equipment specified by your physio or occupational therapist well in advance of your surgery date. Some of the items will be installed in your home and may require someone who actually knows what they're doing.
Consider obtaining your equipment from the Red Cross Loan Cupboard, which loans equipment for up to 3 months. Medical suppliers and retail stores may also carry the items you need. You must arrange to have equipment in your home before coming to the hospital. If you are from out of town and plan to recover in town for a few days after surgery, make sure you have the right equipment, like crutches or a walker, where you'll be recovering. Your physio or occupational therapist will provide you with a prescription for the equipment you require. Arranging for help at home.
Before you come into the hospital, it is really important to identify a support person to stay with you and assist you at home after your surgery. Ideally, someone should be available to you for 24 hours a day for the first 3 days after you go home, and then be available to you for up to 2 weeks. You will also need to arrange for someone to pick you up when you're scheduled to leave the hospital. Now, if your family or your friends are not able to be around, there are private agencies that your healthcare team will help you contact. Now that we've covered what you need to know before you enter the hospital, everything from what to eat, how to modify your home, it's time to take a tour of the hospital to show you who you'll meet and what to expect.